your race going?
Thank you, Mary. Can you hear me okay?
Perfect.
Super. The race is going fine. And as you mentioned, I am running for governor of Minnesota. It's been fascinating watching the way the last 5 years have unfolded. And I think so many of us would say, how in the world did this happen? And I oftentimes quote the words from Esther 4:14 that perhaps we're in the position we're in for such a time as this. But what I really appreciate about you and so many other heroes, everybody's sort of coming at this from a different angle. Certainly, you've got Dr. Peter McCullough, and he's done fabulous work. You've got Robert Malone, being involved with the advisory council on immunization practices. You've got Dr. Marty McCary running the FDA. You've got Vinay Prasad involved. You've got Jay Bhattacharya running the NIH. You've got people that are truly being champions. And part of the reason I'm running for governor, Mary, is because I think we need to have people in the political realm telling politicians, listen, you don't get it. What we went through was horrifically wrong. Informed consent was kicked out the door. People died horrific deaths. There's families still grieving and feel guilty about what they watched through a pane of glass. And I think we need to literally occupy places at the table from every angle. It's the only way that we're really going to be able to learn what we need to learn from what we went through.
I could not agree more. We all have our little niche in how we're approaching this. I don't think I could ever be a politician because I'm not very consensus minded. I feel like I'm more direct. But you have a wonderful soul, a wonderful heart, and you're so well spoken, exude kindness and integrity. And you're right. I mean, it's very frustrating because nothing has been done. I mean, Trump was elected a year ago. Kennedy has been in a position of power for, 7 months now. And the pandemic is for all intents and purposes, has been forgotten. But the only thing that gives me hope is that people are not getting these. We know that the vast majority of people are not, despite the efforts of our government. But let's get back to your campaign and tell us what you want for Minnesota, and maybe focus on the medical side to begin with. But if you want to expand, that'd be great.
Thank you, Dr. Bowden. Well, when I was in the Senate for 4 years, from 2017 to 2021, one of the reasons I was willing to allow myself to be recruited to run was healthcare. And I was really disappointed that there wasn't more appetite to make substantive changes in Minnesota statutes to make healthcare better. And I still am frustrated. I very much appreciate Bobby Kennedy's voice and Dr. Rand Paul. I appreciate that very much, but we need to stop this up and down kind of approach to healthcare as a crisis. At one time in the late 2000 teens, 2018, 2016, the issue of pre-existing conditions was the rage. Everybody needed to talk about that. Then we moved on and it was sort of quiet. And then all of a sudden it was, insulin for people who are at risk for dying sudden deaths because they couldn't get affordable insulin. But we need to get serious about this. And the only way we're going to get serious about this is if we have people willing to be in elected offices and then not worry about the next election, but try to solve the problems. It's funny that you said that you might not yourself, Dr. Bowden, want to be in politics. My wife told me this morning, I was getting a cup of coffee and she looked at me and she said, Scott, I don't know how you do it. And I said, what? And she said, I don't know how you take the flack, the name calling. She said, sometimes I'll see it come across social media. She said, everywhere you go, people tell you how to do things. Everybody's got a different opinion. Everybody's an expert. And she's not wrong. But I really think that I'm not looking for a new career. I love being a family doc, and I'm going to continue to do that as long as I have the good health that I can do it. But I am willing to devote significant time, maybe 60, 70 hours a week in another job as governor and really dig into how do we fix healthcare? But then expanding from healthcare, Dr. Bowden, I think our country's so divided, and certainly Minnesota is. And we need to heal. And I don't think doctors are very good at helping people heal without entering into the equation a sense of hope. And I think when we're able to give our patients some hope, whether it's a cancer diagnosis, a congestive heart failure diagnosis, a chronic renal failure diagnosis, once we sort of insert a little bit of hope, then healing can begin. And that's actually where we see sometimes those miraculous turnarounds where all the doctors had said, "Oh, this patient can go on hospice because they're not going to live more than 6 months." And 3 years later, they're still flourishing. That happens because hope somehow affects neurotransmitters in our brain and in our body in ways that we don't understand, but it makes things miraculous. And so I think as we go forward, we need to heal Minnesota. And one of the best ways to do that is to recognize that there are certain common denominators that both Republicans and Democrats, independents and libertarians, what we all seek. And I think at the end of the day, most of us would say we want limited government. We want less taxes. We want a lower cost of living. But I think we also want to send a message to government to say, leave us alone. Let us live our own lives. And I think so many good people out there recognize also the wisdom in the book of Luke in chapter 12, verse 48, where it says, "To whom much is given, much is expected." And I think people are by their nature interested in giving back to one another, whether it's a food shelf, whether it's volunteerism, whether it's seeing patients on a pro bono basis because they can't afford it, whatever it is, teachers, tutoring kids on their own private time. I mean, I think that's the way we're structured. So I think that's what we need to get back to in Minnesota. And the only way Republicans are going to win an election in a blue state like Minnesota is to recognize that people want to make their own moral compass. Many of our ethical beliefs are born of our religious upbringing and frequently what spirituality we've embraced in our adult life. And I think people understand that, but we're all different. So when it comes to how should we allow people to make their own moral determinations, I think to say it sort of bluntly, I think politicians have proven that they're not up to the task of tackling difficult moral questions. So I think it's just best if we say we're going to stay out of the bedroom, we're going to stay out of the doctor's office, we're going to stay out of the church, and we're going to encourage people to make their own moral decisions, and we're all here to help. And when we do that, I think independents and Democrats would be willing to think about voting for a centrist, reasonable Republican.
I love that. How are people feeling towards Tim Walz right now? Are people frustrated?
Well, I'm afraid it's pretty polarized. I think the last poll I saw, Dr. Bowden, was that Tim Walz had a 47% approval rating and a 47% disapproval rating. So that's unusual because he's generally enjoyed a favorable approval rating. I think the national exposure that he got while running as Kamala Harris's vice presidential running mate did cause him some vulnerability, which in Minnesota that had not become widely regarded or recognized. So that's a big deal, I think. I think the other thing is Republicans are at great risk of once again underestimating their opponent. Tim Walz is an affable fellow. He smiles. He's well-spoken, although sometimes he just sort of throws a word salad at you and you don't know what he said, but boy, it sure sounded good. And I think that's one of his attributes. So when he's asked a difficult question, sometimes he can deflect it just by sort of chattering. But I really think that there's a lot of people who find Tim Walz to be sort of like their favorite uncle. And so we need to recognize that he's going to have a bundle of money. His Rolodex doesn't quit. He's got a team that knows how to play hardball politics. So we've got to be minding our P's and Q's as pragmatic conservatives, and we've got to literally focus on competence over chaos, affordability and accountability, recognizing that the kitchen table issues that most people are speaking about, whether you're talking Minnesota, Texas, Florida, or California, are in some way or another related to the cost of living, safety in your neighborhood, crime in the streets, what kind of education are our kids or grandkids getting? Those are the kitchen table issues. And then again, Republicans have to make special effort to recognize that while there's a space for public policy, there's also a space for personal privacy, and stay out of the personal privacy area. Because if we do that, then all of a sudden we have a chance of having Gen Zs and millennials and even Gen Xers say, we're going to take a serious look at voting for that candidate.
So sort of a more of a libertarian maybe approach to running the government. And what specifically in the healthcare would you change initially?
Well, a lot of people don't know the abbreviation EHB, but in my world, it's huge. And what it stands for is Essential Health Benefits. And if you go back to the beginning of the Affordable Care Act passed during Obama's term, the essential health benefits are way, way too big. You're basically demanding of people that if they're going to buy a qualified plan, it has to be a Cadillac plan. We've gotten away from letting people buy what they want to buy. Many, many folks are very good at recognizing what they want and what they need. I think an awful lot of folks understand the essence of what insurance is. Insurance, when you buy auto insurance, you're not buying a package that also you can use to go fill your tank up with gas, or perhaps have your windshield wiper fluid filled up, or even getting a new set of tires. If you're going to go to a veterinarian, my wife's a veterinarian. My wife Mary didn't have people coming to her saying, well, I've got animal insurance, everything's covered, isn't it? These clients knew that they had purchased insurance for their pets, in case their pets were involved in a car accident or a serious trauma or something like that. But when it comes to heartworm and rabies vaccines and well animal visits, people had put that into their budget. We need to do the same thing with healthcare. We need people to have some skin in the game. I've got a mild sore throat. Should I run to the emergency room or not? Do I need to go to the clinic or not? I'm going to be stopping at Target. They've got someone there who could take a look at me, and it's $89. Maybe I'll do that. When you displace the patient with a third-party payer, you're asking for trouble, and I'm afraid we found it. To me, I think what we need to do is stop connecting patients to systems and start connecting patients to a healer, to a physician or a chiropractor or a nurse practitioner or a PA, a naturopath, a homeopath. I don't really care, because I think at the end of the day, what most patients want is a relationship that's built on trust and advocacy so that they can talk it over with someone. If someone goes to a chiropractor and asks questions that a chiropractor feels are beyond their scope, the chiropractor is not going to try to dazzle them with BS. The chiropractor is going to say, I think you need to talk to your physician. They can help you with that. I do that all the time. I had a patient in today, and they said, could my chiropractor help me with this? I said, yes, your chiropractor would be able to help you, and it wouldn't be me writing a prescription that might create 3 new problems. Patients want someone they can trust. There's a model for it called a direct primary care, where maybe $1,000 a year, a patient gets access to a healer in a clinic. They have 24/7 access. Someone manages their medications. And if they need a telemedicine visit, that's included. If they need to go into the clinic, that's included. And what we're really trying to do is create relationships. That's when people can be told in a very kind and yet blunt way, no, you don't need a total body MRI scan. All that's going to do is potentially show something that isn't significant. You're going to worry yourself sick, and you're going to be wishing you had never been told that. For an example, Mary, a friend of mine was diagnosed 25 years ago with MS. Her symptoms were very, very vague. She was going through menopause. She had increased fatigue. She had a little lightheadedness once in a while. And she noticed that her vision wasn't as good as it once had been. The workup was done. People have no idea how arbitrary our diagnostic algorithms are at times. But in this situation, the MRI showed more than a certain number of little white plaque lesions. The threshold was met. Boom, you've got mild MS. What should I do, doctor? Well, try to stay active. We'll watch you carefully. Hopefully it won't get too bad. I don't think she has MS. I think that her life for the next 20 years became a self-fulfilling prophecy. She thought she was sick, and she started to treat herself as if she was sick. I think that we do this in medicine all the time to people. We scare them. We tell them we got to put you on Lipitor because your cholesterol is this. We don't tell patients that the Lipitor might cause mental fogginess. We don't tell them that their glucose might rise and they might get diagnosed as type 2 diabetic because of the drug we used. These are the things where we've gone wrong.
I could not agree more. This over-reliance on tests as well. That's, you can't treat somebody unless you have a test to confirm the diagnosis, really drives me crazy as well. And yeah, I took this independent third-party free model right before the pandemic started, and it served me very well. It served my patients. I didn't have the government or insurance companies or hospitals whispering in my ear telling me how to treat patients. And that allowed me the freedom to help people the way I wanted to. And I have absolutely no regrets about that. And I encourage everybody to seek out this system. It's called direct primary care. I'm a direct specialty care provider. I'm ENT. So it's a little bit different, but yeah, I call it affordable care. It's usually comparable to a gym membership. You get much more access to your doctor, much more time, and just a higher quality experience. So I'm thrilled that that's your mission.
Well, and Mary, with what you're doing, imagine a patient comes in, they're 30 years old, and what they really want is someone like you. They know they've got an advocate in their corner. They're in the boxing ring of life. If something happens and they know that they've got you over in the corner they can go talk to, and if their eyebrow is bleeding, you'll fix it. If they got a nosebleed, you'll fix it. If their stomach hurts because they got a gut punch, you'll help them through it. But if you could pair what you're providing them with a catastrophic insurance policy that would kick in if they're hospitalized, if they get a cancer diagnosis, that's what an awful lot of people want. They want something for catastrophic things, and they want an everyday person that they can tap into. But right now what they're getting is so often they're paying $15,000, $20,000 a year, and that doesn't even cover first dollar. So they've got to spend $6,000 more before their insurance kicks in. So you could say that of the people that have insurance, 80, 90% of them feel like their insurance really is out of reach. So you asked me before, what would I do in the world of healthcare as governor? I would say, let's get people hooked up to a healer. Let's get them a catastrophic policy, and everything in between, you take care of it. If you want to get a third kind of policy, go out and shop, find it. But I think that there are ideas out there that we could do a lot better job. There's a surgical center in Oklahoma that does surgery only for cash. Their credentials are excellent. Their outcomes are outstanding. And they will do surgeries where you can literally go in and get a hernia fixed, doorstep to doorstep, in and out, and you're less than $5,000 and you're totally done. You go to a standard hospital, it'll be $20,000, $30,000, $40,000. It's nuts.
Exactly. Yeah.
So
that's my model is, I can take out your tonsils for a few $1,000s total, or you can go to Houston Methodist Hospital and they'll charge you $15,000. So and a lot of people, their deductibles are so high, it's cheaper for them, to come to me than to use their insurance. So I have people who are insured that still come to me just because deductibles are so high, it doesn't make sense to use their insurance. Well, go ahead.
So I think, Mary, what you and I have as a task is what you mentioned earlier. Unfortunately, people's memories are short. So we have to, at some level, remind people how dark those days were. For the people that are suffering from the heartbreak of watching bad things happen, we need to help them with that. From the people who are suffering from long COVID, which is a real thing, we need to help them with that. For people that might be suffering from a complication or a side effect from whether it would be a COVID vaccine or any other kind of vaccine, we need to be attentive and help them with that. But at the end of the day, we need to change our policies. And that means we need people to be involved and engaged in terms of who they're voting for in the public elections. Because if we just forget about what happened, we will see this repeat. And I think we need to be charitable to people, recognizing that this was uncharted territory for all of us. Some people made a decision over here. Some people made a decision over here. I don't think we need to try to rub people's noses in it, but I think there are some players that had a true and obvious conflict of interest that probably financially experienced a windfall. I think maybe those people need to be investigated a little bit, because I think sometimes those people knew that what they were doing wasn't truthful. That leaves a bad taste in my mouth. But I think for the most part, we need to be charitable with one another. And I try to do that. I remember, Mary, as an example of when I was wrong, initially in 2020, I bought into the notion that this COVID-19 virus was most likely a spontaneous reassortment of RNA involving different animal species. And it was near a wet market. But I remember watching the evolution of thought and data and evidence. And I remember particularly poignantly listening to Robert Redfield, the former CDC director, when he came out and said that he could no longer buy into that premise and that he thought that it was a lab leak. And then I remember the Department of Energy said the same thing, and the FBI. And I said, when I look at the data, I honestly believe right now that it was a lab leak. And do I have evidence that can prove it? No. But I think it's more likely than not that it was a lab leak than it was a spontaneous reassortment. And that's me changing my mind. So I don't want to hold it against people that they might have changed their mind about policies that were related to COVID, recommendations that were related to COVID. I just think that people who were intentionally trying to deceive America need to be investigated. And people like you and I need to help our country heal.
I agree. I mean, you have the humility and honesty to admit you were wrong, but the vast majority of the people with gigantic microphones who got it wrong are not doing that, and that's where I have a problem. Well, thank you so much, Scott, and all the best on your campaign. When is the primary?
The primary is next August, and I'd encourage people to go to our website. It's drscottjensen.com, DRSCOTTJENSEN.com. We know that we're going to be outspent probably 10 to 1. So, we appreciate any support that people are willing to give. And I want to thank you, Dr. Bowden, for being so unabashedly supportive and encouraging, telling people to, at the very least, investigate who I am. I've been labeled as an extremist, and I'm confused by that, but it is what it is. I consider myself a rational, moderate, pragmatic conservative who really wants to see America heal, Minnesota heal. And I want to see capable, competent government that is compassionate, but also very much accountable. And that's frankly our whole deal.
Yeah. You are measured, and you are a consensus builder, and you're not an extremist at all, but you are strong, and you're say the truth. You speak the truth. And you spoke it super early before most others. So I have much respect for you and appreciate you coming on today. And we'll have you back soon, hopefully primary, so we can get an update and a final push to get you in that spot. So thank you so much, Scott.
Thank you, Dr. Bowden.
Thank you so much. We will see y'all next week. We come on every Wednesday. I start at 12 o'clock Central with Shannon Joy, and then 12:30 to 1:30 on call with Dr. Mary Talley Bowden. And if you want to support the show, please using the products at the Wellness Company. They are like-minded. We see eye to eye on all things. They have passed my very strong litmus test. They are branching out to the bee tree, so they have wellness farms now. So I will leave the link to that in the notes for this show. But help us support them, and by doing that, you support me so much. We'll see y'all next week.